let's discuss fish oil. This next study did find that fish oil supplementation increased what's known as brain-derived neurotrophic factor, or BDNF, which is also nicknamed Miracle Grow for the brain because it literally causes growth in the brain. A 2023 meta-analysis of 12 randomized control trials looked at placebo versus omega-3 fatty acid supplementation. And again, they did find that the omega-3 supplementation group or groups had increased levels of brain-derived neurotrophic factor. They found additionally that the most effective dosing was over 2,000 milligrams per day for a term of 10 weeks or less, and that the omega-3s could be obtained from either fish oil or from flaxseed. Brain-derived neurotrophic factor. How can we test if modulation of that mechanism leads to an outcome of improved cognitive function? Well, we can look for a different meta-analysis that instead of tracking mechanism, looked at outcome. So this enters a 2020 meta-analysis, which we dug up to fact-check this one claim regarding the brain-derived neurotrophic factor. This study looked at cognitive function across 7 clinical trials. This was an elderly subject, so I want to bridle the finding just a touch because it's not always safe to assume what we see in elderly will also happen in middle-aged or younger populations. We may assume to some extent that elderly populations may be easier to get a response from because there may be more malnourishment amongst other things. However, they did find that omega-3s improved cognitive function with a large effect size. And when we think about effect size, said simply, there can be no effect size, meaning it was nil, it was null. There can be small, medium, or large. Effect size gives you a proxy to the clinical effect. A large effect size is almost for certain something someone may notice and say, I feel a little sharper, a little more witty. A small effect size may not move the needle enough for you to perceive the change. So I just want to tie that this meta-analysis looking at cognition, albeit in elderly, did find a large effect size on improving the cognitive function in or across these 7 randomized controlled trials. In our clinic, we somewhat routinely will recommend fish oil supplementation paired with the use of a multivitamin. This next randomized control trial looked at just under 4,000 older adults, about 70 years of age as sort of the average age, who were given placebo or a multivitamin. And in this case, the multivitamin was Centrum Silver, which I do not think is necessarily the highest quality multivitamin. But nevertheless, they found improved memory at 1 year of use. I feel this is important to underscore because sometimes we can get wrapped up in the most bioavailable vitamin out there, and that can lead to buying unnecessarily high quality vitamins. And if that's what you want to do, fine. But if you're on a limited budget, I think it is important to underscore, again, this was not necessarily a super high quality vitamin, meaning the vitamins and minerals therein were not all the highest bioavailability, but nevertheless, we saw the improved memory at 1 year, leading to the group of researchers here to quote, "Multivitamin supplementation holds promise as a safe and accessible approach to maintaining cognitive health in older age."